If you look at your underlying bill and you create a brand new commissioner who can terminate people's individual health insurance without any congressional act, I would think you could accept that a HHS secretary under this division of your new programs, your new bill, could to some extent terminate duplicative grant programs. Duplicative. So I would, you know, especially to my blue dog friends who are trying to do a little cost containment in the bill, this doesn't guarantee cost containment, but it at least directs the secretary and gives the secretary the authority, if you have duplicative programs under this division, to try to save some money. I think it's an innocuous amendment and could be unanimously supported.
Gentlemen, yield to me.
Sure.
Well, it just points out that both sides have now misjudged the acceptability of their respective amendments. First of all, you made a statement that I don't think is accurate. We don't give the authority to the secretary to terminate anybody's insurance whatsoever. But this amendment...
You give the commissioner, you create a new health commissioner that has that authority.
This amendment, I'm not sure that that's accurate. I doubt it, but we could look at that.
Well, we can check it. It's fact.
Because I don't...
Mr. Chairman, I'll be brief, but I simply want to raise the issue that I think Mr. Barton just raised, which is what authority there is to do away with plans and whether the commissioner has the authority to do so. I believe at page 16, beginning with line 20, grace period for current employment-based health plans, the bill by its language says that a plan can exist, a current plan, a health care plan for employer-provided health care may continue to exist for 5 years without meeting the requirements, the minimum requirements prescribed by the Health Care Benefits Advisory Committee for that 5-year period. At the end of that 5-year period, if it does not meet those requirements, it goes away. So as I understand it, the commissioner does have the authority to wipe out all existing plans at that point in time. And I believe that's what Mr. Barton was referring to. It's not something we need to go into now. We can go into it at a later point. Indeed, I'd be happy to ask for clarification from counsel at a later point in time. With that, I'll be happy to yield to Mr. Rogers of Michigan.
Thank you. And Mr. Shadegg and I think others, you point to the huge problem of dropping a 1,200-page bill where I think nobody's read the bill clearly. And maybe, Mr. Chairman, you haven't got to page 44. Under Section B of that page, suspension of enrollment of individuals under such plan after the date of commissioner notifies the entity of determination. So not only can you do a whole plan, which is in a later section in the bill, under this page, they can actually go to an individual and throw you off a plan. So it is clearly under the bill of which you have written that they can throw people off the plan, and you've given not only the secretary, but this new Health Choices Commissioner. And that's what I think is so dangerous. And if you're concerned that they can do that, Mr. Chairman, it sounded like you were, maybe we ought to postpone this hearing and actually allow us to go through this bill and find those instances where you have empowered the federal government to throw individuals off their bill. And by the way, there's nothing in here that even says you have to notify them. It's pretty dangerous stuff, and I'm going to agree with Chairman Waxman that this is a concern, and we ought to work together to get it out of the
gentleman yield? Will the gentleman yield?
It's my time, and I'd be happy to yield to the gentleman from Oregon.
I just want to follow up and maybe enter into a colloquy with my colleague from Michigan, because are you saying that this unelected commissioner can do something to throw people out of their insurance plans without notification, perhaps? Is that what you were saying?
Under the bill that is written and has been presented to us yesterday, that is exactly what they can do. The suspension of enrollment of individuals under any plan after the date the commissioner notifies the entity, they can do it.
So they can do that, and the amendment before us simply says if they're duplicative grant programs, that the secretary should try and eliminate that duplication, right?
That would be correct, sir.
But we're hearing that shouldn't be allowed. That's too much of a delegation of authority. But yet in the bill they can kick people off a plan without. I mean,
and not only do they kick them off the plan, sir, but under this second paragraph down, they can also suspend payment to the entity under health insurance without notification.